Hello, my name's Tim Edwards. I'm a plastic and reconstructive surgeon. I'm also a director of the Healthbank company. Healthbank has a product called Healthbank Consult. This is a secure telehealth program which allows video consultation, for example, between a referring practice and a specialist. Importantly, this program occurs within the Healthbank portal, and this allows consultation to occur within a secure environment. This environment conforms with the RACGP telehealth guidelines. Healthbank Consult allows the referring practice and the specialist to share relevant files regarding the patient. It allows one to access these files during the consultation, and it allows interaction with patients, referring staff and the specialist. One can upload high-resolution images to assist in the consultation, and both the referring practice and the specialist can download referrals and reports to their own practice software which are relevant to that consultation. Importantly, it also provides an audit record of the consultation, which is important in your clinical management, but also given that telehealth consultations can now be billed through the Medicare process, it provides an audit date stamp on the timeline that the consultation actually occurred. I'm going to give you now an example of a consultation, and I have here a high-resolution image that's been uploaded from a rural general practice of a lesion that's come up on a gentleman's back. We can see the high-resolution image, and we can zoom in on that image. We can also go back to our timeline and look at our referring letter from the referring doctor. Here it is now. So we know that the patient has some diabetes, we know their medication history and the referral. We're now going to take a call from the referring doctor who has the patient with him. Hello Gary, my name's Tim Edwards. I understand your doctor has noticed a lesion on your back, a mole on the back that he doesn't like the look of. Tell me about that.
Thanks for seeing me today, Dr. Edwards, and it's certainly great to be able to do it by video rather than having to travel all the way to Adelaide. And yes, the mole that I noticed last week, my wife harassed me to come in and get it checked out, and that's what I've done, and I've had the doctor here's had a look at it and has recommended that we refer off to yourself in terms of seeing if it is actually melanoma and what we need to do about it. So again, I appreciate being able to see you so quickly.
Yeah, well, I think your wife and your doctor have done you a great service, Gary. I think that mole is suspicious, and we certainly should remove it. That's a relatively simple process that can be done under local anaesthetic. And I'm going to have a chat to your doctor and see if he'd be happy to do that for you where you are, rather than having to come all the way to Adelaide. If that's the case, then he'll be able to talk to me via this video link and discuss the results of the histology and whether or not anything else needs to be done once we've seen that.
That sounds great. Certainly being able to not having to leave work for a number of days, working for myself would be a really valuable thing to do. We can do it by video. So
after we've had a chat to Gary, we can return to our consultation here, and we can actually then bring up some case notes. Now, I've done this earlier to avoid you having to watch me tediously type, but we can put in the patient's presenting complaint here, new lesion on the back, possible melanoma. We can put in the clinical findings, which is that we've seen the high-resolution image and we're suspicious of the melanoma, and our management plan is an excision biopsy. Once we've done that, we can submit that to the timeline, and that will then appear on our timeline as a PDF file documenting that timeline. We can return then to Gary here and say that Gary will organise for you to have that excision biopsy. It's a simple local anaesthetic procedure, and then we will talk again on video consultation to discuss the results of that histology and whether or not anything else needs to be done. Thanks, Gary.
Excellent. Thanks for your time.
So that's a quick introduction to Healthbank Consult. There will be more instructional videos on the specific processes that one needs to follow within the program available on the Healthbank Consult website. Thank you.